Welcome to Health and Vitality with me, Dr. Hannah-Lisa Tete. Yes, it's Pink October, Breast Cancer Awareness Month. So this month on Health and Vitality, we'll be looking at breast cancer. On this episode, we'll be looking at the risk factors and how to prevent breast cancer. Breast cancer occurs when cells of the breast divide rapidly and grow abnormally. They may accumulate to form a mass and then they spread to all parts of the body. Now, what makes somebody more at risk than another person? Breast cancer happens in both men and women. However, it's more prevalent in females. And that brings me to my first risk factor. Being a female just makes you more at risk of having breast cancer than the males. So if you have a family history of breast cancer, that is, your mother, your sister, or your daughter has been diagnosed with breast cancer, then you are at a risk of breast cancer. Alcohol intake, especially excessively, has been linked to breast cancer. The older you grow, especially if you're a female, increases your risk of breast cancer. Now, if you have a past medical history of breast conditions, and unfortunately, if you've had a breast cancer in one breast, then there's a high probability of having breast cancer in the other breast. Also, if you have been exposed to radiation, especially around your chest, then you are at an increased risk of breast cancer. Now, if you're somebody that likes eating anything and everything, such that you become obese, it's important you know that you're increasing your risk of breast cancer because obesity has been linked to breast cancer. Now, if you have your menses at a very early age, that's early menarche, before 12 years, or if you have your menopause very late, mostly after 60 years, then you are at a risk of breast cancer. It's also important that you know that taking a lot of postmenopausal hormone therapy has been linked as a risk factor of breast cancer. So now that we know the risk factors, what can we do to prevent it? It's very important that we get informed. We inform ourselves about our family history of disease. So ask your mother, what killed your auntie? What killed your grandmother? Has there been any diagnosis of breast cancer in your family? You should find out to know if you are at risk. Also, if you take alcohol, please reduce your intake, or at best, stay away from it. Ensure that you maintain the right weight. Eat the right kinds of food. Have a healthy, balanced diet, making sure that you take the smallest amounts in the evening. Also, try and exercise. At least 15 to 30 minutes of exercise every day should be enough to keep you in a healthy weight. Remember that it's important that you know the risk factors so that you guide yourself. If there are certain people who do not have any risk factor aside just being female. So please, take care of yourself, stay informed from the right sources, and make sure that you help in the fight against breast cancer. Spread the word out there, and together, let's fight breast cancer this Pink October. Thank you for joining me on Health and Vitality. My name, as always, is Dr. Hannah-Lisa Tete. It's bye for now.